North Yorkshire. So I'm here to talk to you about Medda as a brand. If you asked anybody if they know Medda, it's not a well-known brand. If you ask anybody if they know EpiPen, they do. So just to introduce the company, what it is and why you should buy from them. So again, just an introduction. That's not coming up on mine. Okay, so the brand as a whole. Head office is Takeley, Essex. So it's the 48th largest pharmaceutical company worldwide, so showing that it is established, it is a well-known brand, but it is small enough to still have the patient's interests at heart. It's a patient-driven company and the products represent that. Sorry, it's not coming up. It's available in over 120 countries, so again just saying although it's not a well-known brand, it's established, the products are established and they're well-known. And it has sales organisations in over 55 countries. So within the last 6 years, Medda's grown by 300%, so showing it is a company that's on the grow, it is a company that's developing. And that's because they're mirroring the product with its efficacy, with having the patient's interests at heart, so they're meeting the needs of the pharmaceutical industry. So we are an allergy and dermatology specialist. So going back, if I asked you if you knew what EpiPen was, it is something that's produced by Medda. We hold 98% of the market share with EpiPen, so it shows the trust that medical specialists have with us as a brand. They're buying into the brand. There are competitors out there, but there's no risk with it being taken over. And there's continuous research and development within these two areas. So again, overcoming patient difficulties, keeping the patient's interests at heart, and always answering the questions that GPs have, that medical representatives have, with regards to these areas. We're a brand full of firsts. So Dymista, the first combination drug for all allergic rhinitis symptoms. So it's answering the question, it's answering the difficulties that medical representatives have when meeting the needs of allergic rhinitis. Cyclara, the first product to clinically be able to demonstrate LMAX, to demonstrate that it's treating the field of both clinical and subclinical lesions. And Disomin, the first vitamin D drug to fit every requirement. So just showing that we're not following the pattern, we're overcoming the problems, we're answering the problems, and we're making it a patient-driven company so that it is the answer to the questions. Thank you. Any questions?
Thank you. Well done. Well done.